Each year, Pennsylvania's hospitals and health systems provide care to nearly 2 million inpatients, serve patients through 38.5 million outpatient visits, and evaluate nearly 6 million people in their emergency departments. Pennsylvania's hospitals are irreplaceable community assets that provide access to a broad range of essential health services and are a safe haven and a safety net for our most vulnerable citizens. They also benefit the community by offering charity care and free and reduced cost services such as immunizations, health screenings, dental care, and counseling. Many of these programs and services would not exist without hospital resources.
We are a safety net. An individual has an accident, cuts their hand, cuts their leg, child falls, breaks an arm. They know they can come to Jersey Shore Hospital and we will take care of them.
So it's getting out, it's going, not having people necessarily come to Pocono Medical Center, but for us to go out and have noontime conferences. We're out with the businesses and industries in town. We're working with the school system now to see how we might be able to bridge that gap in terms of getting to the PTAs and getting to the parents, and just different venues where we're able to offer these health screenings.
In communities across the state, hospitals are providing healing, health, and hope to millions of individuals and stable employment for nearly 600,000 Pennsylvanians. In 55 of 67 Pennsylvania counties, hospitals remain among the top 5 employers, providing family-sustaining jobs and solid benefits. The economic contributions made by Pennsylvania's hospitals to local communities and the state have continued to increase, rising to nearly $100 billion during 2010.
The hospital has been a tremendous resource, if you will, of more than just health care. They have helped to sustain what business community we have here in Tyrone.
The economic input of Jersey Shore Hospital on this community, the direct value is about approximately $21 million a year. The spin-off of that into the community generates approximately $38 million a year. That ranks us right up there as the #1 employer and contributor in this community.
The economic downturn has taken its toll on hospitals as patients who lost their jobs and their health care coverage delay treatment and become sicker, and as hospitals treat an increasing number of uninsured, underinsured, and Medicaid patients.
The economic downturn has affected Pocono Medical Center in many ways. We have seen our unemployment go up, so people are losing their health insurance. We see people who are forced to keep their health insurance costs very low, so they take a policy that has very, very high deductibles, and those high deductibles, should they need to be admitted, often remain unpaid and become bad debt. That gets transferred over as then another unreimbursed cost to the medical center.
2 years ago, the percentage of Medicaid patients who used our facility was approximately 3%. Last year, the percentage was 9%. So there's been a 6% increase, which is almost a 300% increase over what it was 2 years ago.
If state budget proposals push for reductions in hospital Medicaid payments, they will be jeopardizing the very jobs that are keeping many local economies intact.
So the hospital itself here is an asset that this community just could not do without.
Medicaid spending generates economic activity at the state level. Medicaid funding supports jobs and generates income and tax revenues within the health sector and other sectors of the economy due to the multiplier effect. This is as important to rural communities as it is in more urban areas. There are difficult decisions to be made, but cutting payments to hospitals should not be a consideration.
Lawmakers are looking at cutting the funding, cutting reimbursement. I would like them to remember that they're not cutting finance, they're cutting health care. They're cutting the care that we can provide to our community.
Without those reimbursements, we would have a hard time keeping the doors open. I mean, it's a hard fact, but it's true.